Assalamualaikum warahmatullahi wabarakatuh. Good morning everybody. Okay, let me introduce myself. My name is Fatimah Zahro. I'm from Muhammadiyah Banjarmasin University, undergraduate of pharmacy. Okay, in this time I wanna explain with you what is coronavirus or COVID-19. Check it out. Coronavirus is the big problem in our country in this year. So, I want to explain with you what is the coronavirus. Coronavirus is a virus who attacks the respiratory system. This disease caused by a viral infection is called COVID-19. Coronavirus can make disorders of the respiratory system until death. Coronavirus or COVID-19 is the new species of virus who can transmit to humans. This virus can attack anyone, like babies, adults, children, the elderly, pregnant woman, and nursing mother. Coronavirus is some virus who can infect the respiratory system. In some cases, this virus can make mild breathing infection like the flu, but this virus can make severe respiratory infection such as lungs infection, Middle East respiratory syndrome, and severe acute respiratory syndrome. The initial symptoms of coronavirus infections or COVID-19 can be flu symptoms such as fever, runny nose, dry cough, sore throat, and headache. After that, the symptoms can be worsening. So, if you feel your body have symptoms like that, please check your health in the hospital. If symptoms be worsening, the patients can experience high fever, cough with phlegm and even blood, shortness of breath, and chest pain. However, in general, there are 3 general symptoms that can indicate someone is infected with the coronavirus that are: first, high fever more than 38 degrees Celsius. Second, cold. And the last, hard to breathe. Based on research, the symptoms of coronavirus appear within 2 days until 2 weeks after exposure to coronavirus. To confirm the diagnosis of COVID-19, the doctor will carry out the following follow-up examination. First, blood sample test. Second, a third swab test to examine sputum samples or PCR test. And the third, test radiograph to detect infiltrates or fluid in the lungs. Infection of coronavirus cannot be treated, but there are several steps from doctors can take to relieve their symptoms and prevent the spread of the virus. Namely, first, prevent COVID-19 sufferers to undergo the treatment and quarantine at designated hospital. Second, provide fever and pain relievers that are safe and in accordance with the patient's condition. Third, encourage sufferers of COVID to do independent isolation and adequate rest. And the last, encourage sufferers of COVID-19 to drink lots of water to maintain body fluids levels. Okay everybody, I think it's all I can explain with you about coronavirus. I hope you can keep your health and don't go anywhere, stay at home. So, I'm Fatimah Zahro. Sorry if I have many mistakes. See you and see you later. Wassalamualaikum warahmatullahi wabarakatuh.